So
No, that's outrageous. Actually, I didn't go to the one last weekend. I went to the Chiefs game the week before, and I
okay.
got one tall boy, and it was like $18, and I was just like, man, well, that's the only one I'm paying.
Because because I mean,
They're paying for
if
that
we're
stadium, paying for the.
yeah, you're paying for the atmosphere. But I mean, if I'm going to talk about the Rams, Stetson Bennett had an awesome game, except for the 4 interceptions. And if I'm going to be, you know what I mean? Like,
I was gonna say.
except for the 4 interceptions, it was an awesome game. But that's just like saying Trevor Lawrence is worth $250 million, even though he's got more dropsies than anybody in the league. So,
Yeah. Well, he didn't play too bad against the Chiefs, and then I don't think the starters played any.
preseason,
They
I
didn't play
don't.
any series this last game, and apparently Doug Peterson announced. I don't even remember who we're playing this. I think we play whoever we play. It's on Friday, and apparently our starters are going to play the first 2 quarters. So that'll be
Yeah,
interesting.
until somebody gets hurt and then they're gone.
Yeah, well, let's hope that
E-
doesn't happen. But
I mean, even if it's just like, oh, he rolled his ankle, everybody out, out, go home. Don't even stay. I don't even want you in the stadium.
we'll see.
So we'll
But
see how it goes.
I thought that was different. Like I said, I
Ah,
don't think they played, or at least Trevor didn't play last game. It was just Mac Jones
well,
mostly and Bethard. But I think Mac Jones will be he's gonna I think he's gonna win out the second backup
that should
spot.
be easy. That should be easy for
But
him.
Bethard hasn't been playing that bad either. But I
No,
think
but he's
I
a
think you gotta get
he's a journeyman quarterback.
yeah, you
I
gotta
mean, I don't know. He's been a backup on what, like 10 teams in his career?
yeah, yeah. I think the last team he played for was what, the 49ers. I don't know. But you're right.
Yeah,
Um
it was somebody. But anyway, so yeah, you
yeah,
want to get started? Let's punch it.
let's do it. Let's see who we got here. Boom, boom. See some new faces in here today. Love it.
Let's do it.
I hope everyone's doing well. I appreciate you guys joining in for today's session. And for those of you that are joining new, we have been doing these webinars since October of last year. And the goal behind these webinars is to really just create more awareness in the compliance realm, and also create more awareness for our customers as well. And hopefully you know any of these, well, for those of you that are joining new, take a look at our YouTube channel. I'm going to post it here in the chat. We've done plenty of different topics covering from HIPAA privacy, HIPAA security, OSHA. We've talked about Medicare related topics. So please take a look at the catalog. If you haven't subscribed, please do. There's quite a few videos to go through. But today's topic, for those of you that were not on last week's webinar, we've been doing a couple episodes on the recent cyber attack on Ascension Health, as well as Change Healthcare, and we did a recap of that last Tuesday, and also talked a little bit about the recent CrowdStrike dilemma, I guess you can call it.
Go.
But this topic, it's not necessarily related to cyber attacks, but more so, it's on the HIPAA security side
Well,
of things.
it could.
It could, yes, it could end up that way if you're not doing things the right way. But we're going to be talking about ensuring workforce compliance in a hybrid work environment. And I am joined by my co-host, Jose Jr. here. He's done quite a few episodes with me now. But again, those for you that are joining new, he has over 17 years of experience in healthcare consulting. Currently owns a mental telehealth clinic here in St. Augustine, Florida. And always happy to have him on and his expertise with these things. So
Oh, it's always fun. It's always fun. And who doesn't love hearing their own voice, right? So
yeah, exactly. But
so
let's talk about it.
so
You know,
we gotta split this up, right?
yeah,
Because whenever I mean, especially even pre-COVID, right? We need to split this up between revenue generating activities and then everything else. And
great.
here's what I mean. So clinical, versus admin, even support clinical, right? COVID kind of forced the healthcare industry to figure some of it out, but it was kind of a fly by the seat of your pants, whatever you're comfortable with. And that's kind of how that went, right? So, but if we're going to attack this in a manner that is a little bit more stable and long-term focus rather than short-term focused, one, we need to figure out what kind of practice we have and what kind of services we're rendering. Okay. Because the easiest thing for us to do currently is our basic services through telehealth.
Sure.
There's already a component for that. We've been able to do that honestly through since the 90s because you've been able to do phone consults as a provider since the 80s and the 90s and get paid for it. Now it's CMS is requiring audio visual when possible, unless there's an emergency. So this is where you have your video conferencing tool, which I would be shocked to find an EHR that does not have a video conferencing tool, at least white labeled into their product because of the prevalence of this, right? So, at worst case, you use Zoom and you make sure that it's protected and it's passcoded and all that fun stuff. And it's person to person, not just like on a bulletin board. You're good to go. Cool. As long as everything is documented properly, you can bill your same office visits. Obviously, there's a limitation, right? But this is where we can talk about remote monitoring some other time. There's ways to get around it, and by hitting certain measures, even if you're on a value-based system, where you can get paid similarly, if not the same, as in the office with less stress. And I say that because most of our clientele and most of our viewers are administrators, or at least in management of some kind. So we know that the hardest thing to do is deal with the human element. And providers are special creatures. They don't tend to get along with too many of themselves in a small area, much less front desk people and billing people and management, and then the pharma reps, and then the patients, and then themselves. So you see that providers can rub patients the wrong way, or they can even rub staff the wrong way. But if you're in a situation where I'm kind of bent over a barrel here and I need this provider, but he doesn't get along with the majority of my staff, kicking him home could be a way to avoid all of that for everyone. Now, there's certain things that you need to make sure when we're doing this, no matter if they're clinical or if they're administrative. One, are they a contractor or are they an employee?
Good point.
If they're a contractor, none of this matters as long as you have a BAA. If you
Yep.
do not have a BAA and you do have a contractor, you've assumed all the liability for all the stupid things another business does. Because that is what a contracted person is. A contracted person is a separate legal entity, a separate business entity. IRS thinks of it that way. CMS thinks of it that way. You should think of it that way. All
So,
right.
Jose, in other words, let's just say your telehealth clinic, right?
Mhm.
You're subcontracting
Half my
a
providers are
counselor. Let's just say
contractors.
a counselor, a
Yep.
counselor, and they're working from home.
Yep.
Um, they're responsible for their own setup, correct, and their own security to an
Let's
extent.
let's take it one step further. If
Okay.
they're a contractor, they can be in China, India, Canada, right down the road. They can be in a room in the office. I don't care. As long as they have the appropriate licenses and they've taken the appropriate protections in order to be able to do their job. Because as a contractor, it's none of my bloody business, right? There's a certain line that we have, right? Obviously, I'm going to check to see if you have a good medical license if you're a provider, but I mean, like all the compliance things, all of that fun stuff, that's the key.
Not to say that I don't know if you've ever seen this scenario before, but what if let's stick with the counselor, right? Let's just say
Yeah.
they're working from home and maybe their server gets hacked or their IP gets hacked and they're logged into your EMR systems.
Ray, you don't even have to go that far. What happens when a hurricane hits and they lose power? Your internet's out if you lose
Internet's out.
power.
Yeah.
But if they're a contractor, that's on them. Me
Exactly.
as an owner of a separate entity that I hired you to see patients, I don't care. You said you were good to go.
Right.
Let's go. What happened to your backup plan? What
I
happened to
basically
your
just
disaster preparedness?
right, right. I basically just want to stress the importance of when you're, when you're signing these BA agreements, that's what you're attesting to. You got to have these things in place.
Yes. If you are going to be a contractor for a practice, you need to understand that there's quite a few things that any BAA is going to have. And a lot of that is pushing liability off in the case of a breach. However, I have seen some BAAs that are pretty wild contractually in the respect of like, hey, if you're supposed to be seeing patients and you can't do the job, you owe the practice. Don't bill me for the hours. I'm billing you for what you messed up. So, like, there can be all kinds of things there that you want to be aware of. But that's a whole nother bag of tricks. If you
Sure.
want to talk about that, definitely sidebar me. So, if you're clinical, this is a pretty cut and dry situation. If you're a contractor, you're on your own. Cool. If I am an employee, if I have an employee working from home and they are clinically based, I need them to have one, a device that is protected by the company in order for them to see the patients. Two, either a VPN or we need to set up their home Wi-Fi to have two separate Wi-Fis, one for home devices, one for work devices. This is not uncommon. Most modems, I would be shocked right now if you got a modem from an ISP that cannot do it. Let's put it that way. All right. So it's really that simple. Now, on the setup, if you try to set it up yourself and you barely know how to set up a computer, you're going to have problems. Right. So make sure that you have a professional, the ISP tech, tell them, hey, just go ahead and set it up for two Wi-Fis and just be done with it. It'll take them 2 minutes because they're familiar with the devices and everything, whereas it may take you 2 hours just to find the right screen. Okay. Now, once we have all that done, we need to make sure that the employee also has the backups, the disaster preparedness, right? So this is where, okay, if your internet goes out at home, if your power goes out at home, we may invest in a power battery for you, for your
Mhm.
laptop. Or we may say, hey, okay, that means that we have 3 hours until this power comes back up or you have no power. This may be something that if you set up a VPN on the laptop. You can use the hotspot on most new phones. However, then you can get into sticky situation compliance wise, so it's not recommended. Sometimes it's easier if the company already or the organization already has a cellular plan to
Mhm.
just get hotspots and give them to the providers or people working from home along with the laptop. Okay, this is where your inventory list comes heavily into play. Why? We don't have infinite resources. You need to know where your resources are so you can get it back.
Right.
You can't just go and be like, okay, Bobby was working from home today, Susie's working from home on Thursday, and just hand it off. No. If Bobby was working on it and you're going to give it to Susie, you need to follow the CRUD protocols, which means we need to either wipe everything, we need to clean it, we need to update it, do all that fun stuff. So that way we're good to go there because they may be seeing different patients. Therefore, there's no reason for Susie to have access to the patients that Bobby sees. Unless you're a small practice where everybody cross trains and providers switch patients back and forth, then you have less liability there. Okay.
So like
Now,
access
one other,
control,
yeah,
essentially.
yeah, yeah, yep. And then speaking of access controls, remote devices are remote devices. I can't prove that my provider is 100% only doing the things he's supposed to do with that work laptop, unless my IT sets it up that way. So if I just bought this laptop from Office Max or Walmart or Target and said, here you go, Bobby, go work from home, I
Of course,
need to make sure that IT is protecting it, that IT is monitoring it, that we limit or completely disable the ability for these devices to access things that can cause problems. For a lack of a better term, right? the laptops for Panacea Alliance are only supposed to be able to do 4 things. 1, access the work email. 2, access an internet browser for the EHR. 3, have a camera and a microphone so that way they can do the video call. And 4, to be able to send the information back and forth. That's it. Those are the 4 things I need. I don't need
Limit your
Microsoft
liability
Word.
on the
I don't need
devices.
Excel. I don't need them to get on Amazon or be able to get on Amazon. I don't need them to get on Facebook. I don't need them to get on Instagram. I don't need them to get on. The list is ad nauseum. So it's easier to just say, look, you can only access these 6 things. And it should be easy to do because you're the one that owns the device. Now, I see this a lot. Provider says, hey, I want to work from home. I hate PCs. I only work on Apples.
Oh man,
Drives me nuts.
that
So
drives me
problem
crazy
number
too.
1, we need to confirm that all of the things that we do for work can work on those Apple devices. 2, we need to tell the provider, do not use your personal device for work activities. If you have to explain it to him or them, or, whatever pronouns are related, whole nother friggin' thing. I always use this example because they're a provider. They know what a clean room is. They know what a surgery room. They know how important it is to keep those rooms sterile. So you
Sure.
say, hey, would you, after going to grocery shopping, go into a clean room to do a surgery or procedure on a patient? No. Okay. After washing your car, after mowing the lawn, after taking your kid to a park, after no, 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 no. Okay, cool. So then why would you bring your personal device into a sterile work environment? You do the same thing.
Yeah, they would.
You do the exact same thing. So they just need to understand that the tech factor here completely mimics the physical factor they're accustomed to.
Right.
Okay. So now that that's pretty much covered, I think that one's pretty cut and dry. Some of the compliance stuff, sneaks in and everything, but that's the easy stuff because most people are traditionally accustomed to it.
Well,
On
I
the
know you.
admins, go
I was
ahead.
going to say, and maybe you mentioned it, I just didn't hear you, but you're talking about, obviously implementing VPNs, access controls, multi-factor authentication too. I mean,
Absolutely. But I mean, if I'm using this laptop at work and I'm using it from home, the multi-factor authentication really isn't going to kick in because it's a device that is already familiar to the
true, because it's sort of a.
to the user and to the platform. Unless you set it
I
up
was
to where you
thinking
have
you,
to
you
use
could set
multi-factor
up.
authentication every time you switch IPNs or VPN, yeah,
Well,
IP
that.
address. I'm sorry.
Yeah, I guess that would make sense. I was thinking as like a practice owner, anytime that the laptop goes to, yeah, I guess would go to a different IP address, then it just, yeah, you got a
Yeah, if
multi-factor.
it's going to a different user, then yeah, different user,
Well, I
absolutely.
was
But I
using your
mean,
scenario of, you got one, yeah, you got one work laptop and you're giving it to Susie and you're giving it to Bobby
yep,
one
yep,
day. That
yep,
that
yep.
sort of situation.
Yeah,
So
so then you would want the multi-factor authentication because you're wiping one and then it'd have to redo it for the second one. And
right.
even if it doesn't, a lot of times it'll be like, I don't recognize this address. A lot of the EHRs will do that. I don't recognize this address, or you haven't used this address in a while. What it's going to send to this
It's
phone
gonna
number
make
and
you
then
do
or
it.
this
Yeah.
email or whatever. So
Yep.
now, mind you, the biggest problem with a hybrid work environment is the human element in 2 ways. One, we get a little bit lazy when we work from home. Most people, because they don't have a specific spot to work in. This is my kitchen table. This is my bed. This is my, so we have to make sure we have good habits and that everyone understands this is wonky. When you hire
Mhm.
somebody for these kinds of things, especially on the admin side, you want to make sure that you can see their face. So it truly becomes a hybrid work environment, unless there's always exceptions to the rule, but it's easier to set the rule very, very conservative and then give yourself leeway. So, for example, my providers have a rule. 1 day a week, you have to be in the office. The other 4 days of the week, you can be in India, you can be in Brazil, you can be, I don't care. But I want to see you. I want to make sure that everything is working the way it's supposed to be working. I want to know that you're there, right? It's that
Of course.
I want to know how you work by watching, but not watching you, but being around you when you work, right? Um, that is a very normal concept, but you got to build that into the contract. You got to build that expectation. And if you're an admin, there are certain positions that you never talk to patients. So if you never talk to patients, it's pretty bloody easy to work from home.
Right.
You just have to make sure that you have the tools, whether it's a fax machine, whether it's the ability to access, billing and go that route. If you're doing QA, if you're reading notes, like whatever your job title is, you need to make sure that you have the appropriate tools. And if they are an employee, you as the employer need to make sure they have the appropriate tools, and that the appropriate tools only allow them to do the tools for the job you have them do. So again, I go back to the same limitations we want to put on the provider laptops. We want to put on the billing laptops. We want to put on the QA laptops. We want to put on the nursing laptops. You know what I mean? Like there's no reason why everybody should be farming, playing on Amazon, looking at stuff on Instagram, like
Well,
it's
there's, and maybe you implement it at your, I mean, you have employees that work from home, correct?
during COVID, especially, we had people that work from home.
Yeah.
I work from home half the time. The providers are all
We, we used
90%
to
virtual.
we used to use an application called Hubstaff, which it was very useful during COVID. And
Yeah.
it basically just it tracks everything, your clicks and
So
how much productivity you are. It'll even show you what screens that you're on. So
so yeah. So I mean,
there's
remember, everybody
apps.
needs to also remember this, right? If you've been in healthcare for more than 5 years, you probably don't recognize this. But if you've been in healthcare more than 5 years, the every other industry is light years ahead of us when it comes to technology and the use of technology, right? So that's why I go back. When it goes to meaningful use, we did this number and then we started really catching up while the rest of the world was already doing this number on the technological advancements, right? So have we started doing the whole click thing? No, because I gotta jump. So, for example, if I'm a provider or
Mm,
if I'm billing, I gotta jump from the EHR system to my billing system to my credit card processor to my emails. So I'm jumping around quite a few things. So I'm not just in one environment. So it's easy to track the clicks and all that stuff. However, I can limit on the device what you can and cannot access. So it's far easier for me to just do that and just say, hey, here's your dump computer because all it's good for is accessing these things.
right.
Bye bye. You know what I mean? Like, bye bye.
That makes
I don't
sense.
even want to give you a ton of, I don't want to give you even a ton of memory on the laptop because I don't want you downloading crap because more crap I have to delete. Right. So
More work for you.
you need to figure you now. I could argue that in all of healthcare business, you probably have 90% of the business that you could do virtually. The 10% is the HR stuff, is the workflow stuff, is the intangible, environment of the practice, the culture, so the interpersonal stuff, right? So, but that 10% takes up 80% of an office manager's time. Maybe seven. Interpersonal with just the employees probably takes 40 to 50%. But 40 to 50% of that is also with patients dealing with nonsense or patients dealing with the employees, both good and bad, right? So we got to be able
Sure.
to figure that piece out. Now, there is a certain aspect of what should be hybridized, even though a lot of things can be hybridized, right? And that's where a lot of PEOs come in, or the ACOs come in, or MSOs come in, or any other alphabet organization to help you with the admin of your business. So you could have one HR person and share it over 4 or 5 practices, because you don't need a dedicated HR person for 10 people. You know what I mean? Like, so there's certain
Sure.
things that it just makes sense to hybridize and not bring them into the practice, because you don't want to absorb 100% of the cost. Is that one of your people? Maybe we're bursting at the seams, right? And I'm one of those people that likes to forward think like that, because I want my business to grow, not shrink. So when I go and think, okay, I have currently 1, 2, 3 exam rooms. I have a closet that we can turn into a quick turnaround exam room for my patients that just, hey, I just need my script, because by law I can't have more than 90 days of the script. So, yep, everything's good. Give me my script. Bye. And they're out of there, right? So it takes longer for them to walk to the room than it is for the visit. It's just kind of how it goes
Right.
for certain things. Every specialty has that kind of patient, right? So then, okay, cool. Then they don't need to have a really nice room or anything like that, or take up a lot of space, but I can put those patients there. Okay, cool. Then I have 3 exam rooms. Okay, well, my office manager is technically in a room I could transform into an exam room, but then I'm kicking out my office manager. Oh, all right. Well, then you know what I mean? So there's certain things where when we're looking at, especially in that time frame of, we are big enough to look at a bigger space, but not big enough to afford the moving into a bigger space, because it's one thing to afford it and another thing to need it, right? So this is where you really, having a hybrid team can really, really help you out, because then, for example, you can have one provider who's seeing patients virtually 100%, but then another provider is seeing patients in person.
In person. Yeah. Yeah.
So even though I may only have 3 exam rooms, I'm utilizing 4 exam rooms, or 5 exam rooms over 3 providers. You know what I mean? Like,
It's a good
you
way
can
to.
really play with the numbers, so that way you can really get things moving. And then if you include the remote monitoring for some of your lower level patients or your more chronic patients, that then your RN or your bullpen even can be trained to, hey, all right, Susie, what's your blood pressure today? Okay, you don't have the blood pressure cuff from your DME? Cool. Do you have your smartwatch? What's your smartwatch telling you? Hey, how many steps does your smartwatch say you've taken today? Hey, you know what I mean? Because all of these different technological devices, if they could do telemedicine, they could do a lot of this remote monitoring, or they have devices that are doing it for them and they don't know how to track it, which is a completely different bag of tricks, but it helps us as an environment, as an industry, to be able to be more hybridized, right? There are certain things that you can do by just babysitting the patient, and you can bill for that stuff. Watching them do it,
A good
like if you have
follow
a
up.
PT, yeah, follow-ups, PTs. Obviously, before you do anything clinical, you want to make sure that you check with your local board, any of your services, so you know what you can and cannot do. I'm not going to go into all those details, because 50 states, 50 different sets of rules, right? So not going to touch it. But then when we look at the admin side of things, we just have to worry about PHI. We have to worry about the breaches. But it's a lot of the same crap. Don't do stupid stuff. Do I trust you with the device? How often are you traveling with the device? Are you just working from home? Or are you a person that actually travels? You know what I mean? Like, hey, maybe I'm a provider and I travel from a nursing home to the office to my house, and I'm working in all three. Or I have multiple locations. You know what I mean? So, okay, well, now you're taking this device with you. Okay. Now we have to think about this just like back in the old days, when a provider would carry a box of medical records to the nursing home. And if you don't go that far back, I hate you. But, but that's what providers used to do. They would go to the nursing home, and either the RN or MA or they would carry a big old box with all the medical records. It's all fine until you get into a car accident or your
Yeah,
car gets stolen, or you know what I mean? Like, what? Or look, we're at the age right now where there's
before
quite.
they had mobile shredding services.
Well, I mean, it's you don't need a mobile shredding service if you need them to see the patients, right? Like,
Right, right,
we
right.
haven't even gotten to that part, right? We're just talking about, okay, well, now instead of it being paper records, we have a laptop, we have a tablet. Is it locked, or can I just open this thing and da 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 da, I'm in? You know what I mean? Like, so we have to have some of the same common sense. It's really not that hard to figure out how to do it. The harder part is who should do it.
How about Jose, the scenario where you got a counselor conducting a telehealth to a patient that's not the patient's not at home. Maybe they're in a Starbucks somewhere.
Doesn't matter.
Doesn't
Doesn't
matter.
matter. Well, here's why. It takes two to initiate a call. If the patient is comfortable picking up that call to do that visit, wherever they're going to do it, they have to be comfortable with the consequences. That's not on us, that's on the patient. So if the patient wants to talk to me and I'm their infectious disease, like, or
Is
I'm
that
their,
mentioned
oh,
by the counselor? Like, hey, I noticed you're in a public setting.
it doesn't need to be.
Okay.
By law,
I'm just
by law, it's a carve
just
out.
curious.
It's not on us. What would be on us is if we were using, and this happened quite a bit, but it happened more prevalently during COVID with
Mhm.
Zoom and schools, right? Where
Oh
any
yeah.
Tom, Dick, and Harry could jump on the
Kid
video
joining.
call for the school, and they started doing all kinds of wild stuff, right? So you have a situation where the same thing can happen with the medical side. However, how do we limit this? Okay, so Bobby, I'm going to send you the link for your video call. Do you want me to send it to your cell phone or to your email? Email. Perfect. Okay. So I sent it to their email. If they have their email open on 4 different devices that 3 different people can look at,
Can-
what do you want me to do? That's not on me. That's on
right.
you as the patient. Take some responsibility for your ish. You know what I mean? Like, it's so, I mean,
Not
and
to say that
legally,
probably happens often where you got a patient that answers in a public spot, or maybe it does. I don't know. I was just generally
I
curious.
can tell you right now, I have one patient that I know of in our practice that he works for a roofer, and he is notorious for grabbing, especially when he knows I have a new provider. So the practice has a good relationship with him. So we use him to kind of test our new providers.
Hmm.
He'll always take the call on the top of a roof. And he'll always say some crazy stuff like, "Hey, this is the only place I get signal," and
Screaming out the
it's just
top of his voice.
wild. Yeah, it's just wild, right? So it's just funny. So I mean, if they're comfortable taking it there, then that's on them. You know what I mean? Like, but this is where you'll have a lot of people that now they don't have to leave their work for 2 hours, 3 hours for a 15-minute visit.
Yeah.
Now it's, hey boss, I'm gonna go grab a
Man
quick
can
smoke.
make the call while he's on the job. Boom.
Well, preferably while not on the clock. I'm
Yeah,
not going to go and
yeah,
get
not
anybody
on
into
the roof.
trouble with that. I'm not going to recommend it either. But hey, doc, hey, boss, I'm going to go take a walk. I'm going to go, I'm going to go do a non-smoker smoke break. I'll be back at 15. Go to your car, knock it out. Walk around the
Yeah.
building, knock it out. Get some steps in while you're at it, right? Like it allows for a giant amount of flexibility. So our patients now don't have to lose money 3 different ways. One, by taking time off to come to the office for the appointment. Two, by paying us for the visit. And then three, by paying for whatever meds or tests they got to do afterwards. Now they're only losing it 2 ways, and it's for the actual services. Now they're not losing their income based on how expensive freaking groceries even are now, right? Like, forget meds, I can't even pay for groceries.
Yep.
Like, so I mean, it's just a matter of how can we make this easier? So hybridizing things can be very, very effective. It can be very, very good way to make your business work efficiently. You just have to make sure you have the right people for it at the end of the day, right? This is where I hate to say it, but maybe a certain age of person may not be right to be hybrid. because they're
That's a good
not as
point.
tech savvy or tech clever, right? Whereas, hey, they remember what a CMS 1500 form looks like. They know how to, they know what to do. If A fails, then they go to B, then they go to C, but they may not know it technologically. So
I'd
you
almost want to
lose
hire
some.
somebody that like has worked from home before, or at least and has a little bit of experience doing that, right?
So again, I go back. Working from home can be really, really nice, but it can be a
I
real,
personally did not like
real
it. I
drag.
did it during COVID and not for like the first I guess the first month in we worked from home, and then I had the option to come back in, and I just came back in full time because I just couldn't do it. You mentioned it earlier. I didn't really have a official space. I was in my kitchen on my dining room table. It just didn't feel right,
Well,
man. Didn't feel
if
right.
you
But to each their
believe
own, obviously. But I felt more
now,
productive
mind you,
in
yeah, now mind you, there's
in an
certain things
office
that
setting.
yeah, now mind you that there's certain things that since COVID, people are either more aware of, so it makes the research a little bit wonkier because things are higher. But since people
True.
have been allowed to work from home, depression has actually gone up
Uh,
because we don't have as much interaction
yeah.
with people. You know what I mean? Like if I don't have a wife or a spouse or kids, so I live at home by myself. I'm at home by myself all day, every day. I now don't have to leave the house for work. I now technically don't have to leave the house for grocery
For
shopping.
anything.
You will be a patient of mine.
Yeah.
There's no way you
God.
don't end up
I was
depressed.
waiting on you.
I
I was
don't care. I don't care how much you say you like being alone. No one likes being alone that much. There's a
right.
reason why that show Alone, everybody craps out in 60 days. You know what I mean? Like you go crazy. It is a form of torture, is solitary confinement in prisons.
I mean,
They break hardened criminals that way. All right. So, like, to think that
I
people can
agree
do
to an
that like
extent. I
that,
agree with you because the
it's
my biggest thing
wild.
was I like the human interaction.
Yeah.
Talk. Being able to talk to coworkers, not through a Zoom call every day.
I
I don't
mean,
know. That's just like I said, to each their own. For me, it
so
wasn't my thing.
So again, I'm of two minds of it, right? Like, so a piece of me is like, God, I hate the water cooler talk.
Yeah.
But God, that's what makes the organism, the environment for your business, right? So it's not necessarily limiting the water cooler talk, it's limiting what kind of talk is at the water cooler.
Yeah. Yeah.
Right, so this is a cultural thing that starts, I hate to say it, but it actually starts from the middle out, not necessarily from the top down, right? Because I own my practice. I
Yep.
feel like I've got a great relationship with all of my employees and all my providers, but I know for a fact I'm not their friend, and I'm okay with that. Because I know that when I walk in, there's certain ways that they act when I'm there versus when I'm not. I have children, it's the same thing. Right? So this just
Yeah.
the
Good way to put
hybrid
it.
work environment is nice. It just needs to be used the way that it is designed as a hybrid, not as a complete substitution. Especially if they're brand new. If they're brand new, you don't get to work from home. I need to see you. I need to make sure you're doing
Sure.
things correctly. Right
That and
now, again,
training too.
well,
Generally,
and the training side of it, and
yeah.
I want to know that you are doing things the way you're supposed to be doing it. Right now, there's certain things that just by design they're virtual because it's in the name. A virtual assistant, a virtual answering agency. You know what I mean? Like we can just keep going down that list.
Mhm.
A dictation service, right? A translation service. I can just we can go down forever, right? The point is, if you can understand what it is that they need to do and they are an employee, you need to get them everything they need to do their job right. If they don't do their job right, that's on you as a manager. Because either you didn't train them right or you didn't catch them doing it wrong fast enough to get rid of them. But it's on you. I hate to put it that way, but it's on you. If my kids go and I'm not paying attention to them, well, I have one. He's currently napping. He's being nice to me today. But if he wakes up and
Um,
wrecks house while you and I are doing this, who's that on? Is that on the toddler or is that on me?
that's on you, my friend.
Exactly. So why do you think your employees are any different?
No, that's a good point. Good
You
point.
know what I mean? Like someone has to take accountability. And that's the entire purpose behind every single piece of legislation regarding HIPAA is who takes responsibility? Who is going to own the screw up? Which is why people fight about it, which is why we have the BAAs, which is why you're seeing now that most practices are doing what they can within their resources, but their vendors are not. Their contractors are not. So the issues are coming from them because those vendors and contractors normally aren't on site.
Right. Right.
So you have limited oversight, even if you wanted to oversee them.
So
So until that shifts, we are going to continue having these problems, right? And hybridization can be a good thing. I like it. I am a huge proponent of using technology, but it just has to be done properly. You have to train your team to do it properly. You have to train what you expect from them when they work from home.
that and
You know, like,
have a good IT or MSP working with you as well.
yeah, I mean, setting up a set. So how can I put this?
The
Oh,
setup's the first. That's like phase one.
well, so
Getting
it's
things.
just like bowling, right?
Yeah. Yeah.
Okay. We've got the lane, and we've got the I don't know, what do they call them? The trenches, the trenches,
The
right? I don't know what
gutters.
the hell they call the gutters. There we go. That's the word. So if I don't cover the gutters, you got two different ways you can get into trouble. If I cover one side, okay, well now we only have to worry about the other side. If I cover both of them, okay, I have literally guided you down the lane. There's nothing more I can do. This is on you, boo. You know what I mean? Like, this is the same thing dealing with employees and setting them up to work from home. You
Yeah.
give them the guide rails, you give them the bumpers, and you say, stay within these bumpers. You and I won't have a problem. Get out from these bumpers. You and I are going to have a problem, right? Because it doesn't
Yeah.
matter what birthday party there is at a bowling alley, there's always that one jackass that throws the ball at the bumper to see if he can get it into the other lane.
Almost always.
You know what I mean? Like, I wonder if I can forget getting a strike right in front of me. I've never done that before, but let's go get a strike with two lanes over. All right, you ready? You know what I mean? Like, all right, that guy needs to get fired. That's all.
No,
That's all there is. That's
no,
You can't save
absolutely.
everybody. Don't bother.
It's a good way to
We
put it.
gotta save
I like that analogy. The bowling.
which one, the
The,
bowling alley or
the
the
bumpers.
saving
The
people? The
bumpers. Well,
bumpers.
that
Yeah,
too.
we just gotta put the bumpers out. If you manage to find a way to screw this up, don't worry, you'll be remembered forever. If I set up the bumpers properly, if I didn't set up the bumpers properly, I'm never gonna mention it because it's on me.
Think there's any I don't know, this might be hell, this could be a topic we can discuss in the future, but like AI related
So
integrations for
remember what
hybrid.
AI can do, right? Like what is the purpose of the AI? So there are certain things that AI can do, but nothing they can't see patients currently. And if for no other reason, then there are some AIs that are doing visits, but those organizations are not getting paid for those visits because the AI is an AI and doesn't have a medical license. You break the
Sure.
system entirely when you let an AI who has not gotten a medical license, is not accredited by any board to see patients, you break the whole system. It's not, the system wasn't ready for telehealth.
I
You
was
think the
thinking
system's
more
ready for that?
I was thinking more so like an AI that
You can't do an
maybe
AI for billing.
it could maybe predict a security breach, like your setup or something. I don't know.
That's what a penetration test is for. That's what the passive monitoring is for. right? So like the problem is that the things that still need people,
Mm.
especially on the admin side, right? So if I'm just working on talking to patients, scheduling, making sure that they've got their follow-ups, all that stuff, all right, I just got to make sure that you've got a phone number that even if you're using your personal cell phone, that it appears to the patient that it's the office number. Most phone
Right.
systems can do that. It's spoofing a phone number, not a big deal for outgoing calls or for incoming calls. Not a big deal. That's very, very easy. The big deal is, okay, if you want to use AI, what can we do it for? I can't use it for billing because that's what the clearinghouses are supposed to be doing, and those bloody people are
What
still
you
taking our money for doing nothing. I will repeat this till the day I die. Clearinghouses do nothing anymore. Um, and I will shout that at people that work at the
got any billing
clearinghouses.
anybody from billing department in here?
There's no way that anybody can argue it because here's the whole purpose behind the clearinghouse, and we've gotten off tracking it, but the whole purpose
It's
behind
all
the
good.
clearinghouse was that they would take your note, your, for lack of a better term, your invoice it, transform it into a way that the insurance companies could each individually read it. Your EHR does that now.
Yeah.
You don't need the clearinghouse. The EHR bloody does
What are they
that.
supposed to be, a second pair of eyes now? That's it.
That most, if that, they
Approving
don't
body.
scrub. Most of them don't scrub anything.
That's crazy.
But anyways. So, I mean, going back to your AI question, they can't fix billing. It can't fix requests for specialists. It can't fix scripts for pharmacy. It can't fix ordering for imaging or labs or so. I mean, AI can maybe you can get an AR to do some of your an AI to work on some of your AR stuff and find where there's billing issues. But most of your billing companies already have systems that do that, or your insurance
True.
companies are telling you what's going on when they kick it back. Of course, assuming that the insurance companies are kicking things back for things that make perfectly good sense, not like, oh, hey, I'm not going to accept this bill today. But when you saw that patient 2 weeks ago, the information was the same on the patient, but now I'm not gonna. I paid that one, but I'm not paying this one. You
Right.
know what I mean? Like the insurances are retarded, so I don't really. They don't make any logical sense. And anyone that tells me that they do doesn't work in billing because I'm telling you, man, I could sanitize any practice can sanitize one patient with any insurance, and they will randomly have the insurance not pay certain ones and pay certain ones, even though the variables are the same. Same patient, same product, deductible's been paid, they pay copay, and magically they decided not to pay this. So then we have to go and fight it. And then when they
Mm.
don't pay it, or they pay 100%, or they pay 150%, and then the next one they pay 25%, it's a bloody mess. Even Medicare is a mess. And no one at the insurance
You gotta
companies
fight for
cares
your
enough.
money. It's just nuts.
Yeah, you have to. You have to fight for your money. So, but anyway, so when it comes to the hybridization, the topic for today, though, Ray, gosh, getting me on all these bunny trails that wind me up. Um,
It's just giving me ideas of some topics that we can do because we don't
yeah,
have
yeah, yeah, yeah.
we don't have
Yeah,
any in
I
the
mean,
near future. We
I'd be
gotta
more than happy.
yeah.
Like we can pull up some. I can sanitize some notes, and we can do some all kinds of fun stuff. But you can do all kinds of crazy things when it comes to hybridization. What is the purpose? What is the stated goal for that employee? What is in their job title? What is in their job description? And then it's just following up, making sure they're doing the job from home. So that's why I say that you don't normally want to start something like that. You want to give them the opportunity. Like for example, especially when COVID was going, right? You had hey, you got to stay home for 5 days. But I feel fine. I don't care. You tested positive, go home. Here's the laptop, though. If you feel like working in 2 days, text me and we'll get you going, rocking and rolling, right? You know what I mean? Like,
Right.
then you can do that and everybody wins. I get part of my productivity back. They get to get paid. Moving on, so If you've got questions, concerns, every office is a little bit different. I'd be more than happy to go through it with anybody. But usually it's going to be the same answers, like 80% of this is the same. It's always a bell curve. So
Of course.
make sure you've got your IT locked in and locked tight on what they're supposed to be doing with the devices. Make sure that your employees are not finding ways to break it because life finds a way. And if they do break it, I want you got to write it down. And you got to be like, hey, IT, and
Document.
reassess. So cool. Any
No, I
questions,
appreciate
concerns?
your input, Jose. And yeah, if anybody has any questions here, please feel free to throw in chat. We'll take a few minutes here to answer those questions. And I know it was mentioned earlier, but Jose and I, we represent Epi Compliance, which specializes in healthcare compliance with HIPAA privacy, HIPAA security, OSHA, and Medicare waste, fraud, and abuse regulations. And our goal is simple. We want to protect our customers in the event of any kind of snafu was to happen. That maybe on the hybrid side, if you don't have your bumpers covered per se.
Yeah, right. Yeah. If you don't have
Um,
the bumpers, get the bumpers. If you don't know what the bumpers are, you don't have them.
I was gonna say Epi Compliance is the bumpers.
No, yeah. But I mean, even from there though, like it's a step one. Not
Yes,
all
yes,
steps are covered, right? Like you
yes,
still want to do some customization.
absolutely.
So
But also, if you have any topics you'd like us to discuss, we ask this every week as well for our audience. You have any compliance related topics you'd like us to discuss in the near future? Let us know. Very open
yep.
minded here, and we'd be glad to take a look into it. Don,
Cool.
Patricia, anything? How did we do? Are you having a good day?
Hopefully we're not boring you guys.
I know.
So cool though.
Awesome. Well,
Let's
Jose,
punch
I,
it.
I appreciate your time, and
Yeah.
you and I well, usually we'll mention a topic for next week, but we're still kind of figuring that out. So everybody that did attend this webinar, you will receive some correspondence with the next week's topic. Oh, we got a hand raised. Patricia, might have been on accident, maybe. We at least know that she's a real person.
She is not a bot.
She is not a bot. Thank you, Patricia. I hope you found some value out of this. But if you come up with any topics, let us know. But we will be sending out some correspondence for next week's subject, and look forward to seeing everybody on that as well, and future webinars as well. And I did send a link to our YouTube channel. If you haven't subscribed yet, please do, and take a look at some of our other previous episodes we've done. It might hold some value to you.
Cool.
Thanks,
Cool,
Don.
cool.
Appreciate that feedback. We hope to see you on next week's session. All right, Jose.
Yeah, I'll kick you some topics, right? And we'll see what we got for the next couple weeks.
Sounds good. I
All
appreciate it.
right.
All right,
Thanks,
everyone.
guys.
Thank you. Take care.
Bye.
Sunshine.